Hi, my name is Sandra Cassarella, and I would like to talk to you about how the clinic got started. This was before 1970, probably 1969, 68, where a group of us got together and tried to form a free clinic. We were kind of a ragtag group, and we formed a board. I was on that first board, and we did everything to try and make some money to start this clinic. We had white elephant sales and bake sales, and you name it, we did it. And finally, it came to fruition, but there were a lot of people that did the groundwork so that the clinic could succeed. There were many doctors that did not want to participate because the thing in Laguna was, it's going to bring in more hippies. And luckily we did find some doctors that we could do the work at the clinic, but it was very grassroots groundwork going on, and there were a lot of people that were involved in it, or it wouldn't have happened. Well, I was in Laguna since 1962, so this was a little bit later. I'd been around for a while, so I knew Laguna, and I knew lots of people and who were the same mindset as me, and I don't know how, we just all of a sudden got together and it happened. Oh yeah, we pounded the pavements and made phone calls and tried to raise money and get people involved and fight the stigma that was going around about having a free clinic.
Thank you for coming. Ed, our past president, is sitting back here, and I love working behind the scenes, but I don't really love being where Ed used to be here, but here I am, and I really appreciate people coming. We record this even with, we have a wonderful audience tonight, but we keep it recorded and uploaded to have it as research for future years. And it's a story that needed to be told. It's been told by newspapers and by the Laguna Beach Community Clinic, but we haven't done it as a historical study yet. So we are so happy Korey volunteered to speak about the free clinic, which was... And the Laguna Beach Community Clinic, and also sometimes just called the clinic, which Mary Anderson, who's in the audience, told me too. So it's a real big part of the community of Laguna Beach because It started in '72, meaning it's 52 years old, and it's still here. It's a non-profit. It's not affiliated with a hospital or religious organization, and it's had ups and downs, which Korey will talk about, but it is community-based, and it survived and had thousands of volunteers, probably, yeah. So those who couldn't be here will watch it on video. I will let Korey kind of go over his curriculum vitae, because he has that, but we have a PowerPoint to support it, and we'll kind of try to hold questions and answers to the end. I know there will be some really good comments for people who've been along the way part of the community clinic. So thank you, Korey. I'll hand it to you.
Thank you, Karen. And thank you all for coming tonight. The Laguna Beach Community Clinic is right next door. And how many people here have actually been in the building? Okay, yeah, several. It's been around since the early 70s. It started over here on Glenary Street, right across from the parking structure, and moved on to the present Ocean Avenue, where the Anastasia Cafe is. We were there for a long time, but then bought this building next door, and it's been a wonderful place to work and to help develop, and there have been lots and lots of people who have done that. I've been around long enough that people know I've been associated with the clinic, but really there were so many folks that were instrumental in getting it going, and there are two of them in the audience right now. These two folks right here, who got started really early putting the medical services together and getting the clinic organized. So I owe a debt of gratitude to you also. It was in the 70s that the clinic got started, and it was at that time that we had a lot of uninsured folks here in town that were oftentimes subject to poor health conditions. Maybe they were drug addicted, or the flower children, etc. Lots of sexually transmitted infections, and the clinic is really the place to go for that, because we've got great testing and great ability to diagnose and treat people who had sexually transmitted infections. So that was our business early on. That and women's health in general. So lots of pap smears and breast exams, etc. It was in the about 1975 when our crisis intervention part got started. And that I think Mary didn't you do that?
I was not part of doing therapy or anything, but yes.
Yeah, that's what
the clinic for Sleepy Hollow was.
Yes.
Yeah.
So the clinic used to be at Anastasia, but just down the street where
it's now Hogue.
Yeah, that medical clinic is by the bus station. It's called Hogue now. And that location was where you worked, Mary, and our mental health services were, and rape crisis, etc. In 1982, we got started collaborating with UC Irvine, and we were a great location for them to send their student doctors and student physicians, the medical students and resident physicians still in their education, to come down for a rotation of a month or so in a resource-limited setting such as ours. Family medicine, general stuff, walk-ins. It was really a good experience for them, and the people that I mentored there were all really grateful for it while they were there and also when they left. So in the 80s, we continued that collaborative relationship with UC Irvine and really helped educate a lot of people, giving them a taste of how you take care of poor people and not break the bank doing it. Also in the 80s, we started getting more funding from sources such as, the city. God bless the city. They were instrumental right from the get-go, helping the clinic get off the ground. Because our city fathers recognized the need for medical care for the throngs of newcomers into town, mostly kids, they helped get us started with money and continue to support us. We're not a city affiliate, but we certainly benefited from their generosity. We also then developed ability to raise money through HIV grants. The Steele Foundation was very instrumental in helping us over a long period of time. Irvine Health also helped. And the AIDS Education Task Force, which started in 1985, also brought more educational resources for us, as well as some personnel improvements. But in 1994, that's when the Ryan White grant was started. And Ryan White was a kid that died of AIDS. He lived in Florida, and he was ostracized by his school as a child because he got HIV when he was a newborn. And so this person ultimately died of AIDS. But when I think about him, I start to cry. But it was Ryan White, that was his name, that he is the one who galvanized our federal government into devoting funds for care for people who had no money and were HIV infected. So he did a wonderful service for us. And then in 2002, a tobacco settlement, settling a lawsuit with the tobacco industry brought us a ton of money too. Not just us, but healthcare providers everywhere, low-income healthcare providers. So we got a dental suite on that. So at the clinic now, we got medical service, dental services, psychological services, all these women's health, reproductive health services. It's a fabulous place to go. And I use it myself as my primary medical care home. When I get a cold or I need to go in to have my blood pressure checked, that's where I go. It's good quality care, easy to get to, price is right, and so I've been very, very happy with that. So the Laguna Beach Community Clinic has been a wonderful resource for our community, and frankly, for me. I enjoyed teaching, and I was able to do that at the clinic with the UC Irvine residents and students. And I also, of course, like the challenge of providing medical care on a budget. And the clinic does that very well, including still. We get audited by ourselves to make sure we're doing the job right. We also get audited by various programs that pay us money, like the federal government or the state government, and we've always been recertified as a federally qualified health center, FQHC. The big deal, probably many of you have heard of it, many of you might not have, but the FQHC designation means that the feds have come in, they've taken a look at us, they've taken a look at our results, they've taken a look at our records, and they've decided these folks qualify. And that's us. So I'm very proud of the Laguna Beach Community Clinic for having accomplished that and continuing that mark of excellence. So that's my, am I on? Yeah. That's my little advertisement for the clinic. I'm a real big fan. And, but historically, we owe a huge debt of gratitude for the folks that came along early on. Ronald Kaufman is a person in this city who I didn't really know, but he helped get that clinic going because he rented space to us. Mary Anderson, who's sitting here, also was very helpful at getting the clinic going and providing energy there. Barry Fisher was a gentleman who lived here in town. I haven't seen him for a long time, but he was on the original board of directors and a good supporter, although he himself was not hugely wealthy. He was able to provide funding when he had it to help us. Bill Anderson, a physician who's here in town and practices down by the bus station, he was also a real early volunteer at the Laguna Beach Community Clinic, and he's the guy that got me started. I was out at El Toro with the Marine Corps, and Bill said, you know, there's really this cute little funky clinic down in Laguna Beach. I think you ought to come down and take a look at it. And so who could resist that? So as soon as I got licensed in the state of California, that's what I did, and I really liked what I saw there. An early employee there, another doctor, was Dr. Tony O'Sullivan. He was our reproductive health guy, OBGYN, and he was the medical director when I came on board. He was going to go to Palestine and work over there for 6 months. So he said, Korey, would you please take the medical directorships and I'll be right back. So, well, okay. And then, of course, he didn't come back. He got sick, and he didn't die, but when he got back here, he didn't want to go back to work. So I had the pleasure and the honor of being the medical director there for a long time, quite by accident. And I have not objected to that at all. That was really a great experience. So the Laguna Beach Community Clinic is a place that I'm really fond of. My son, who lives here in town, helped me do some maintenance there one time. We fumigated the place.
You did it yourself?
Yeah, we did it ourselves. So we put off these little bombs. I don't know if you ever used them, but you know, the mist goes up and permeates the place. So we thought, well, that's really going to be helpful. But we were a block away and could smell that gas. So of course, I don't know how long it really stuck around to do its job, but made me realize, probably could use a little sealing and insulation in that place too. But Garth, he used to work with the Laguna Beach Community Clinic, and he still lives here in town, still has a fond spot for a fond place in his heart for the clinic. And my grandson also knows about the clinic, knows who works there, knows I used to, and so it's a kind of a family affair. I'm going to invite people to ask questions as the time goes by here. If something occurs to you, I did not prepare lengthy remarks, but I do want to open up for questions if anybody has them. So if you just kind of raise your hand, it would help me know that you've got something to say. Yeah.
Can I just make a comment?
Yes.
I happened to talk to a man today who used the clinic years ago.
Okay.
He lived right down the street and he could walk to it. He didn't have a doctor. He just moved to town. He happened to be gay, but I think it was before the epidemic, you know. But he praised it no end.
Yeah. Well, good. Thank you for that.
I was going to this meeting tonight.
Oh, sweet.
Didn't come, no.
Yeah. Well, thank you for that
He lives in
feedback.
Lisa Viola now, but he had lived here for years.
Yeah.
Yeah.
I can remember one of the services that we provided at the clinic was walk-in evaluation and treatment, so that if you didn't have an appointment, you could still get seen there. And I remember one day realizing how important that was when a guy came in saying he'd just been downtown. And he just was kind of stopped because he just wanted to get a little checkup. He said, I just didn't feel very good. I started feeling bad downtown. I said, well, what happened? He says, well, I don't know, but now I'm kind of sweaty and out of breath. And he said, I've got this funny squeezing discomfort here. And I said, well, have a seat. Let me call the paramedics. And bless them, they're just a block away. So they came over and took him over to the hospital, because he was, in fact, having a myocardial, a heart attack. Good chance he would have died, because, things happen. He's in the process losing heart muscle, but the paramedic got there right away, got him taken care of, oxygen on out the door. And I saw him about a year later, and he was, back on his feet, feeling good and doing just fine. Sexually transmitted infections were a huge issue in the early days of the Laguna Beach Community Clinic, because there were no other sources of care that were really free of the stigma or the people just didn't always feel comfortable with the sexually transmitted infections and going to their private doctor. So it was a great place for people to do that. And the common scenario would be a guy would come in and say, well, I've been having a little bit of burning when I try to urinate. And so this guy would be with yellow discharge and gonorrhea. So it was possible to then right then and there get his partner in. So we got now we got the contact. So we get at least those two treated. And because of our accessibility, and because we could do it without charging, it was really a great way to preserve this man and woman's fertility for when they decided they did want to have children. And by getting the venereal disease eradicated, it helped both of those things. That's the kind of service that the clinic did and still does, and I'm really proud of the fact that the clinic has been able to help a lot of people in that way. So the sexually transmitted infections were a big source of work, but we also did lots of medical services, treating people with high blood pressure, stomach trouble, diarrhea, urinary infections, and what have you. The care was good quality, free, and pharmaceuticals were typically, we oftentimes were able to prescribe, to give the medications at the same time for people who didn't have money. So that's really what I wanted to tell you about the clinic. It's been around for a long time. A lot of the folks here in this room have been instrumental in getting it going and keeping it going. And I'm wondering if there are questions about, yes?
So, Dr. Korey, do they ask people about their immigration status before they get treated?
That's a great question, and the answer is no. The immigration status is a real sore point for a lot of people without documents. They're often concerned that somehow that the immigration service will get involved, or that will call up the police or something. And so it is tough for folks who are not documented. They need to know that they're going to get treated and without stigma. And we have a reputation for that because we do not ever inquire about immigration status. We do not ever require a social security number. That isn't that we don't need that because we're not. We just don't. So people we have a reputation for being accessible and not concerned about immigration status. So good question, Joyce. Thank you for asking it. Yes?
When our family came to Laguna in '73, we met a family named Marley. Does that name, do you recognize that name? She worked very closely with the homeless here.
Yes, I do know her. I don't know her. I don't remember what she looked like, but I know the name. And
I know her. She was my neighbor.
Was she?
And she was very involved with the clinic for many years when I was actively involved with the clinic. And then she moved up north.
Then she went to Seattle,
Yeah.
worked for the homeless there, right down on the street with them, and she used to talk how the homeless would steal her shoes day after day after day. Anyway, she's a wonderful person and just loved to deal with the homeless.
Mm.
Her husband taught folk dancing in around Laguna for years.
Wow.
Ted Mark.
Well, say hello to her if you see her again.
Okay, thank you.
I'll tell you why. It was in the mid-70s that happened. And in order to get any kind of funding, we needed to become a community clinic rather than a free clinic. It helped us with billing, for instance, for Medi-Cal covered services, for women's health, the birth control pills and the pap smears, etc. So we made that change in the mid-70s.
So in order to get any funding at all?
No, we could still get funding, but there were so many programs that you needed to. It helped open doors for funding in other areas.
So you were considered a category, you changed your category in the eyes of funding?
Yeah. Yeah, you had your hand up earlier, then I'll get to you. Yes, Ann?
Oh, do you deal with mental health issues?
That's another really good question. Yes, we do deal with mental health issues. Physical health and mental health both. We have, and we have ever since the 70s. So that if people come in needing, with concerns, say about depression or talking to themselves or hallucinating, whatever, we are able to evaluate them and get them into a proper treatment program. Many times our own staff are able to handle those things. For instance, someone that is depressed. Okay, we've got people who are very interested and experienced with antidepressant medication and counseling. So those folks' needs can be taken care of with or without medication. But for the folks that are talking to themselves and hallucinating, that's really beyond what we can do. Yes?
Yeah, I worked there as an intern back in the 70s, and I worked with I remember a lot of the young children, young teenagers, going into the office and they were hallucinating. And how did you deal with those? I know that, to me, that was like the major focus at the time, because we had such a huge influx of the hippies, and the young kids were just freaking out on LSD. Well,
a lot of times, and I wasn't there during the day. I wasn't one of the people doing this, but a lot of times you can get them sort of talked down so that they can at least listen to you and follow directions. So that's one of the things that any of our staff has experience doing. And then the important thing is to get them into care where it's appropriate. I mean, we don't have anybody that haul out the straitjacket and get out the Thorazine, so we got to get them to someone that is more comfortable doing that and more equipped to do it. Yes?
Yeah, I just wanted to say that, go back a little bit further in history.
Yeah.
Because I was one of the people, many people, that tried to get it started in the first place. And, we had meetings, we used to have sales, selling, or getting paper, saving paper, and getting money, and it was a very, very grassroots sort of thing. And of course, we had a lot of trouble finding people, especially doctors, to work there, because everyone in the town, not everyone, but a lot of people in town, it's just going to attract more hippies. It's just going to attract more hippies. And the very first day that it opened was actually in 1970 as a free clinic on Glenary.
Yeah, okay.
Yeah, but it was a lot of work putting that together.
Well, thank you for doing it. I think that what you did was really hugely helpful to the community and to the people that you were serving. And to people like me, who was going when I got here to town. Yeah?
I was just wondering, do you only serve Laguna Beach residents, or is it broader than that?
Yeah, we serve people no matter where they come from. You don't have to be a resident of Laguna. And many of our patients are Lagunans. People say, well, what do you mean, poor people in Laguna Beach? Well, yeah. We all have maids, we all have pool people, we all have gardeners, we all have folks sweeping our lawns. So those folks need care, and waiting on our tables. They need care that they can afford also. So, yeah, we take folks no matter where they're from, and when we were free, we just simply never, finances never became an issue. Now, there, of course, if people want to get medical care under a program, for instance, Medi-Cal or Medicaid or one of those, there are income criteria that you have to qualify for, but in those days it was very simple, at least a lot simpler than it is now.
I
Yes.
saw a picture when you were just starting this, and it was of the waiting room there, and I was telling Karen, when we met with her, that we used to pass the hat. That's what we would do at night. They would just pass it around the room and see, whatever, somebody would be $5, somebody would be $10, you didn't know. But, we did do that, because my belief was always, even if they pay 50 cents, sometimes they listen a lot better when they pay 50 cents. Because when they think it's for free, well, you know what, maybe it's not so good. So I would always say, no, we need to get the money. You need to go around and say, you need to give us something.
Yeah. So when people pay for it, maybe there's a placebo effect that they think it's better. Well, I think you're right.
Can they get Medi-Cal? When I was there years ago, we actually had someone come in and they could qualify for Medi-Cal at the clinic. They didn't have to go somewhere else and qualify. Can they still do that at the clinic,
At the Laguna Beach Community Clinic, which is right next door, yes, you can apply for Medi-Cal there.
That's good, because if they can't get it there.
Yeah, right. And there are other programs as well for low-income people that are not Medi-Cal. If you're not documented, you can't get Medi-Cal unless you're pregnant. But if you can get other forms of payment. So there are clinics such as ours. We specialize in folks that can't pay, and you can get them signed up for some other program that will usually pay much or all of their cost of their care. Yes.
Korey, you must have picked up a number of things that you couldn't treat or follow. Can you talk about the challenges of getting those folks to hospitals or specialists or
Yeah. So what do we do about What do we do about people that we can't treat? And that's a huge issue for any clinic such as ours. But we do have a lot of contacts with the community and with resources, so that almost always, not always, but almost always, we can figure out some way of them getting their care paid for, which then means we can refer them if need be. So let's say you got, I don't know, a headache and the doctor thinks it's cancer in your brain. Okay, we're not equipped to treat that, but we know people who are, and we can help them get the resources they need, the Medi-Cal or whatever, to pay for that brain scan and pay for that consultant. Now, that being said, not everybody wants those patients anyway. It's commonly believed, it's not true, that poor people will sue you. And the fact is, poor people are very unlikely to sue. They don't, they just don't. I don't know why, but they don't. So that's a spurious cause of concern. Another one, though, that is a legitimate concern is they feel like, well, if I, see Joe Blow and he needs something and he can't get it because he doesn't have any money, then is that going to reflect badly on me, the doctor? Because I sent him out of here with a life-threatening problem, gave him a prescription, he couldn't afford it, so now he's dead. Well, those are conundrums of financing medical care that are really, really tough, but that's not a daily occurrence. So there are things that we can't treat. We do our best to find consultants who will and resources to pay for it. The big ones are OBGYN, urology, kidneys, prostates, bladders, that kind of thing, and gynecological services like ultrasounds and surgery and breast biopsies and that kind of thing. So good question. What do we do with things that we can't treat? But that's true in your own private doctor. It's true at my doctors too. Well, of course, they are my doctor. But your doctor can't treat everything either, and so he or she needs to refer you from time to time to sources of care. Yes.
Mary Anderson, when she spoke, and I heard this from other people, it was sort of a best kept secret that there was a free clinic in town.
Mm-hmm.
I remember hearing it word of mouth when I was in the 70s or 80s. How do people find out? Because it still seems sort of secretive that you're there. Is it word of mouth still, or how do you?
It is primarily word of mouth. Another source of referrals for us, however, would be from our association with certain programs. For instance, since we do accept Medi-Cal and many doctors do not, Medi-Cal might refer people to us, or a social worker who knows about us might refer people. We don't advertise. Should we? Yeah, maybe. But we don't. We don't have the money to do that. And the word of mouth is the primary way that people find out about us now. And in actual matter of fact, in private practice, I was a private family doctor for decades. Most of your really good referrals come from a satisfied customer. They say, well, go see that guy. He's a pretty good guy. And so they come in already with a nice attitude. He must know what he's doing because Joe Blow told me he's pretty good. And so those referrals by word of mouth are probably the most important practice builder that you can get.
One more question.
Yeah.
Can you touch on, you were El Toro Marine Base, but
Yeah.
I think Dr. Korey is a resident at UCI now, or was before he came in.
Dr. Ball, yeah.
So you had a lot of doctors coming from the Marine Base when it was the 1970s.
Yeah.
Now in the 80s, they come from UCI, or they're residents that help? And
The economics have changed in a way. I mean, we don't get the reason doctors were coming to practice from El Toro was just, it was kind of fun. It was just kind of a neat thing to do, but it wasn't, you didn't get paid for it. And the doctors that we get today are typically, they're people we hire, and nobody goes into community medicine thinking they're going to get rich. They come because they've got a good heart and a good attitude, and those are the folks that we hire. So those are the full-time folks that we would hire, doctors, nurses, and other staff. So I don't know where I was going with that, but in any case. Yes?
Do you have any public information as to about how many patients you see a month or a year or something like that recently?
Well, I guess I'd have to do the math. It's about 30 or 40 a day, so that'd be times.
That's good enough.
Yeah. Mary, do you know how many people?
No, I mean, I know Korey always sends all of these things in these newsletters and says how many people they've seen. And I mean, I think it's been a lot, but I was just trying to think. In the beginning, we were only open at night. We weren't open every night at night. And then once we got our building and moved over here, then it became a real clinic. I mean, where we could do day and night. And that made it, we aren't open at night now, but I mean, then we had day clinics, which was much easier for a lot of people.
So now I remember the idea that did escape my memory, and that is that Dr. Rabal did come from UC Irvine. Dr. Bent, the guy that took the medical directorship after me, was the guy that started that collaboration with UCI. So oftentimes that is where we'll get temporary help, guys and gals that are coming through for a 1 month rotation. But we might also interview them and they'll be hired. I think Tom Bent knew Dr. Rabal because he worked at the clinic as a student, and then Tom liked him, so we hired him to come to work, and now he's the medical director and a really fine guy, really a good doctor and a good administrator. He's a master's in business administration as well as his MD degree. And so,
Korey, isn't there's a lot of wealthy people in Laguna that, you know, it's not out there, but they support the clinic to a great extent.
many of our, we live on donations, and yeah, they're well-to-do folks. Or, you don't have to be well-to-do, you can still send us some money. Yes, we'll pass the hat tonight. Don't anybody leave. Well, I would encourage anyone who has an illness that you want to have looked at right away. This is a good place to go. The quality of the care there is good, and the price is right. So I encourage you to think about that the next time you have a cold and you just like, oh, I just want to make sure it's not pneumonia or something. They'll be able to tell you next door. Yeah.
Do they do rapid testing for COVID at the clinic?
They do. They also do, we also do rapid testing for HIV. And both COVID and HIV are kind of stigmatized. Nobody likes to get either one. But the testing can really help reassure folks that they do or they don't have it. And the HIV testing is, of course, crucial to preventing spread of HIV and keeping people healthy. You know, I'll get to you just a minute. I want to put another little pitch in here. Here in the United States, we continue to get about 40,000 new cases of HIV every year. Okay, we know where it comes from, but we still get those new cases. All right, we also know where pregnancy comes from, and guess what? We get a lot of those too. But the fact is, with HIV, finding out early means you're going to get on medication, you're not going to infect your partner, and you're going to have a normal life. Whereas if you let it go, then you don't. So getting an early diagnosis is really important. And we're able to do that for people. It takes about 10 or 15 minutes to develop one of those tests. You come in, get a couple of drops of blood, and then you know very quickly what your status is. Oh, and you, yeah.
So what percentage of your patients are homeless?
I don't know the answer. The question is what percent of our patients are homeless. I don't know the answer to that.
Can a homeless person walk in?
Yes.
Or a person that has no financials and be treated?
No resources, no insurance, no documents, no nothing. Yeah, they can come in and get seen and get care.
But you do serve the homeless population.
Yeah. I occasionally, I'll tell you an experience that I had next door. I used to see, a fair number of people that came in off the street, and most of them were, tried to be well-groomed, but I remember one guy came in that I was astonished at how dirty he was and stunk. But my name's Dr. Jorgensen. We took care of what he needed. And then I told him at the end, I'm really grateful you came in. I want you to get this medication, and I want you to return in a week because I want to listen to make sure your pneumonia's gone. But you gotta bathe first. And if you don't have a shower, just wash under your arms. But you gotta be cleaner.
Did he come back?
Yes, he came back. He was cleaner. Yeah.
It's a very phenomenal service that you offer the community here. Do you know across the nation or across the state of California how many other services are provided in cities like this?
No, I don't. Does anybody know that?
Well, I do know FQHCs have really proliferated.
Yeah.
That's a program that I think most of the general public has never heard of. That the federal government put funding into that for this very reason. They have a clinic where, correct me if I'm wrong to qualify, if you did turn down somebody walking in off the street, that'd be a problem for those guys. It really is set up to give you know, no questions asked, you know, type of situations. Having said that, I think so many of the clinics, in my experience, at least in Southern California, are religiously affiliated or something of that nature that really makes, that's a stigma for people to walk in, right? And so I think that's the uniqueness of this clinic is you're really just representing the community. So that's really cool.
Yeah, I appreciate your observation there. I serve low-income people both as a physician, but also providing food out at the Laguna Food Pantry. And the fact is that people are embarrassed and stigmatized by coming to get free service or free food. They feel bad about it. So that's just something we have to just recognize and try not to make it worse for them. Yes, George?
The point of coming to FQHC, and you're right, that's not something that people have heard of. But part of getting that funding in greater amount, certainly, is a commitment to growth. And some FQHCs have satellite offices. That will be in the future, like I'm sure. But the growth, somebody mentioned mental health care. We've got a licensed
clinical social worker.
Yeah. So the services are growing. And one other thing I'd like to reiterate, you've said it. Very professional services. This is not a second-rate, four-folk place. And it is a great, like Korey said, his medical home. It's mine also. And open to all. And yes, they still do pay money.
Yeah. And I think it is a well-kept secret in as much as people don't think about going to the clinic. There's a stigma associated with, okay, it treats low-income people, and so there is that floating around in someone's head that therefore maybe it's not any good. But it's really not the case. It's a really good quality care, and I think better than some private individuals provide. So one of the things that's different over there is that there are people looking over your head. You know, you're in a group setting like this. There's at least going to be 5 or 6 other doctors that see this patient in the next month or 2. And so there are people looking over your shoulder. That's good. It really is. It's really helpful. It helps keep everybody on their toes. And then the audits. I used to be the primary guy that did the auditing. You know, you go through a paper and pencil audit, and you find out who's doing the right and who's doing it wrong, and then you can take steps to counsel them about, well, you should be doing this. And if they got HIV and their CD4 counts down there, they need to be on Bactrim, you know, that kind of thing.
Dr. Korey,
yes.
I know this is supposed to be about the clinic and not just about you, but yeah. I just want to thank you for your years of dedication and service, how much care you provided in such a compassionate and dignified way. People who were so scared to come in and get tested or just even be able to be treated for HIV disease. For decades, you were the physician of choice for so many people because you listened without judgment. And many, many people have their lives to thank for the clinic because if it wasn't here, they would not have access to medical care. So thank you for your years of service.
Thank you. And I tell you what, I always love to be thanked, but it's a team thing going on there. You know, it's really not me. The clinic is committed to low-income care, and they're gonna do we're gonna do our level best to see that everyone gets it. As the HIV guy, it was a privilege for me to work there and help maybe reduce people's anxiety about that. I used to have a picture of Magic Johnson I met him and shook hands with him, and had him take a picture of me. So, by golly, that went up in all of my examining rooms, so people knew immediately, okay, this guy can't be that bad, he's treating Magic Johnson.
He's still going.
Yeah, and he's still going. Yeah, I just saw him on the tube the other night. Still looks good, still looks fat, so things have gotta be working for him. Okay. Anybody else have anything they want to bring up? Okay. Karen, I really. Thank you, Karen, for organizing this and for allowing me to speak. So,
Thank you. Thank you. We're the person to do it. Yeah. And thank you, Korey. It tells a story unique to Laguna and to the community in caring. And I loved hearing everything. Thank you for everyone who came tonight. My two children have hemophilia, so I know Ryan White, the name. So they had to watch also for blood, disease, when they were born. So thank you for everyone who was volunteering in the 70s and all that for coming and for being here. Any more questions or comments?
You don't pass it back.
No, we're free. We're a free group today. No money. Yeah, it's just your time here. We appreciate your time tonight. It's not free, and we would love if you visit us at the bungalow. I saw a few people Friday night at hospitality night. We're open Friday, Saturday, Sunday from 1 to 4 p.m. And we love volunteer docents or just visitors to come and look at all the books we have and our website and everything else. So thank you, and see you next time. We have lots planned. Yeah, so good.
Who put this program together? Who did all the details?
Douglas Miller, I have to comment on. He is around town and taking photos, and he got the 1970s, and then courtesy of Laguna Beach Community Clinic website also. Yeah, thank you.